gentlemen, and welcome. Thank you very much for joining me. I'm Dr. Derek De Silva. We are here at the AMMG conference in Las Vegas, and it's a pleasure to have with me Dr. George Shapiro. He is the recipient this year of the Alan Mintz Award for Excellence in Clinical Age Management Medicine. George, first of all, congratulations.
Thank you very much.
Congratulations, and I'll tell you what, it's nice to be recognized for what you've been doing, isn't it?
It is, actually. You know, I've been involved with age management medicine for about 15 years now. You were actually the first, physician who I saw introducing this conference. I think it's a great conference. The way age management medicine has changed my life is significant. From just doing basic traditional cardiology and internal medicine, and then taking care of patients regarding their diseases, and then looking in the future to prevent the diseases. And one of the things that I really enjoy about preventative medicine or age management medicine is slowing down the progression of disease by attacking it earlier and preventing it actually from occurring, which is, for me, my early career has been all about, disease management. So I think prevention and precision medicine, personalized medicine is the future of medicine. And
what really scares me still is that heart disease, and you're a cardiologist, you're a very prominent cardiologist in New York City. Heart disease is still the #1 killer in this country. Correct me if I'm wrong here, but statistics, 600,000 people die of heart disease every year. Every 32 seconds, somebody has a heart attack. I mean, what are we doing?
Well, some of the things that we're actually doing right now are a lot of lifestyle modifications, instructing patients on diet, exercise, reducing risk factors that we can modify, smoking, obesity, people just being sedentary. It's just not really the way to do it. You really want to focus in on lifestyle modifications, and I think you're a big proponent of that. Mm-hmm. Nutrition, exercise, and basically eating correctly.
How have you, talk to me from a cardiology perspective. I mean, as a primary care physician, it's similar but not the same. What do you specifically do from a cardiology perspective that's different than another cardiologist would do?
So my focus is really getting involved with their personal lifestyle, finding out, what do they do? Are they under stress? Are they eating bagels for breakfast? Are they having a buttered roll, donuts, starting their day off with a high glycemic meal, which basically sets them off in a whole path of destruction for the day. And they're gaining 1 to 2 pounds every day. Fat, especially belly fat, as you know, is toxic. It's dangerous. It's inflammatory. It releases mediators that progress to different diseases and chronic diseases that we take care of today. Heart attack and stroke being #1 and 2 in cancer. Even Alzheimer's disease. So if we really attack the gut and get rid of belly fat by enhancing your metabolism. So my focus is getting a baseline evaluation, top to bottom, looking at all their organs, their brain function, bone function, muscle function, heart and lung function. We actually look in their blood vessels with non-invasive techniques to see if their endothelium, the inside lining, is appropriately producing nitric oxide that's dilating their blood vessels. We look at new biomarkers, advanced biomarkers of inflammation, looking at even genetic markers to see if they're predisposed to disease. And then once we find out what their risks are and their predispositions, we can modify those. We spend a lot of time on diet. Many people don't know how to eat correctly. They don't eat the right combinations of foods. They don't even shop correctly. Organic foods are key. Non-GMO foods are key. Gluten-free, dairy-free. You really need to watch what we eat, and most people don't even understand simple, basic items about eating. Exercise is extremely important. You want to exercise every day. And I don't mean running on the treadmill, just walking. Walking 60 minutes a day has been shown in some publications recently that you can extend life expectancy by 25 years, which is significant.
That is significant. That's really significant. So, this is not the traditional, regular, I'm going to the cardiologist to get a stress test, right? This sounds like a whole new paradigm of management, if you will, for the patient.
That's 100% correct. Unfortunately, there's too many physicians out there today practicing medicine from 30 years ago when they went to medical school, looking at their textbooks with old techniques. The key today is to really aggressively prevent the disease. And what we do is really focus in on prevention and taking care of the younger patient and preventing the problems so they won't get a heart attack. I mean, my patient base is a young patient base today, and we're really focusing in on not letting them get the diabetes, reducing hypertension, reducing hyperlipidemia, getting patients to understand certain basic needs of exercise and nutrition.
And I think this is where medicine has got to change. It has to change because what we've been doing for, what traditional medicine, if you will, has been doing for the past 50 years, I mean, look at the statistics on cancer, right? We've had no difference in changing the outcomes with cancer, deaths from cancer, from 1975. I mean, what are we doing? It's just incredible. So what you're doing as far as prevention, and I think what we as a group are doing as far as prevention is got to be the way to go.
Right. This meeting is especially very scientific regarding genomics, precision medicine. Physicians here are presenting some new state-of-the-art techniques on how to look at your genome, your basic architecture inside your body. How can we modify these genes from a scientific standpoint and reduce outcomes that normally people would die young from? So we're not stopping aging, we're slowing it down. We're making people, as they age, become less frail.
Right. And I think that's what it is, quality of life. Right? That's what it comes down to, is quality of life. I want to live till I'm 95 or 100 and continue to play tennis. I don't want to live till I'm 90 or 95 if I can't play tennis. I mean, it's just kind of where we are. And once again, just congratulations for all the great work that you do, for receiving this incredible award. And closing comments, what's the future?
I think the future is very hopeful. Now that we know our genome, we can really look into our body and figure out what's going to happen and possibly edit the outcomes. Gene editing has really got a lot of attention lately. The New York Academy of Sciences, if anyone's interested, has a website to look at all their genes and gene editing techniques that are coming out in the future. So we can actually do a test on you, a saliva test or a blood test, get your genes, figure out what your genome is, and now find maybe 6 or 7 areas that are off, like a light switch, and basically edit that gene using new technology to go in there and turn those switches off, so now you maybe won't get a stroke, you won't get a heart attack, you may not get pancreatic cancer, you may not get Alzheimer's disease. It's real exciting. The future is exciting in medicine. Where the Age Management Medicine Group, I have to say, is really at the forefront of this. They're very aggressive, very advanced. Our team is great, and you're wonderful.
Well, thank you very much. Congratulations once again. Keep up the great work. God bless.
Thank you very much.
And folks, thank you very much for joining us. And until next time, I'm Dr. Derek Da Silva, and may you always be blessed with good health.
Thank you.